The ideal position for a pregnant to lie on the bed. A. Have the mother raise her legs. B. Turn the mother on her right side. C. Turn the mother on her left side. D. Place the mother in Trendelenburg. E. Place the mother in the tripod position. The answer is C. Turn the mother on her left side. Placing the mother on her left side can increase placental blood flow and increase the baby's oxygenation. Placing the mother on her right side, in Trendelenburg, head down, in the tripod position, sitting forward, hands on knees, or with her feet in the air is not of equal benefit. Which of the following assessments is not a focal point of the postpartum assessment? A. Bonding, including maternal, fetal and family dynamics. B. Fundus, including height, location, and consistency. C. Vital signs, including blood pressure and pulse. D. Stool assessment, including consistency and color. E. Lochia, including color and volume. The answer is D. Stool assessment, including consistency and color. The postpartum assessment includes vital signs, blood pressure, pulse, fundus, location, height, consistency, lochia, color, volume, urinary output, measure first void, and bonding between the mother and infant. The postpartum assessment is valuable because it allows for nursing interventions at warning signs of postpartum complications, including infection, hemorrhage, and uterine atony. Stool assessment is not a vital part of the postpartum assessment because it does not lend information to the assessment of potential danger signs. Which of the following ethnic groups should consider genetic counseling for thalassemia? A. Native Americans. B. Northern Europeans. C. African American. D. Mediterranean ancestry. E. Jewish. The answer is D. Mediterranean ancestry. Thalassemia, an inherited autosomal recessive blood disorder, is characterized by an abnormal form of hemoglobin. Those of Mediterranean ancestry may be carriers of the disease and genetic counseling is recommended. African Americans are at risk for carrying the gene for sickle cell disease, another inherited blood disorder that alters the form of hemoglobin. Northern European descendants of Jewish ancestry are at risk for carrying Tay-Sachs disease, a rare, inherited nervous system disorder. Native Americans are not commonly at risk for passing on genetically inherited disorders. How can endometriosis affect fertility and miscarriage rates? A. Decreases fertility and increases risk of miscarriage. B. Increases fertility and decreases risk of miscarriage. C. Decreases fertility and decreases risk of miscarriage. D. Increases fertility and increases risk of miscarriage. The answer is A. Decreases fertility and increases risk of miscarriage. Endometriosis will increases risk of both infertility and of miscarriage. This may be due to a paracrine effect as hormones are released locally by ectopic endometrial tissue, causing disruptions in hormone levels required for implantation and for sustaining an implanted embryo before the formation of the placenta. Endometriosis is more common in the presence of what food allergy-related condition? A. Lactose intolerance. B. Anaphylaxis. C. Endometriosis is unrelated to any type of food allergy. D. Celiac disease, gluten allergy. The answer is D. Celiac disease, gluten allergy. In a study surveying 120 women with endometriosis, the prevalence of celiac disease, an autoimmune condition triggered by ingestion of gluten, was nearly 4 times higher than the general population. No association has been made between the presence of endometriosis and lactose intolerance or incidence of anaphylaxis. What is the most common cranial mononeuropathy in diabetic patients? A. Cranial mononeuropathy 6. B. Bell's palsy. C. Auditory neuropathy. D. Third nerve palsy. The answer is D. Third nerve palsy. Third nerve palsy, cranial nerve 3, the oculomotor nerve, is the most common cranial mononeuropathy seen in diabetic patients. They will present with ptosis, dilated and fixed pupils, and an outward and slightly downward deviation of the eye. Bell's palsy involves unilateral facial paralysis as a result of damage to the facial nerve, cranial nerve 7. Cranial mononeuropathy 6 is caused by damage to the abducens nerve, cranial nerve 6. Signs of damage include inability to laterally rotate the eye and/or double vision. Auditory neuropathy may be a result of damage to the vestibulocochlear nerve, cranial nerve 8. The most pronounced symptom is loss of audition. What condition is described by the following: a defect of copper excretion, leading to copper overload and feedback inhibition of ceruloplasmin synthesis? A. Wilson's disease. B. Huntington disease. C. Ceruloplasminemia. D. Hereditary hemochromatosis. The answer is A. Wilson's disease. Wilson's disease is characterized by a defect of copper excretion, leading to copper overload and feedback inhibition of ceruloplasmin synthesis. This results in copper accumulation, primarily in the liver and the brain. Signs and symptoms include liver failure, cognitive deterioration, clumsiness, and changes in behavior. Symptoms often start in adolescence, but can start any time between 6 to 20 years old. Ceruloplasminemia is a rare condition of iron accumulation in the basal ganglia, retina, and liver. Hereditary hemochromatosis is also a disorder of iron accumulation, often caused by mutations in the HFE gene. Huntington disease is a genetic neurodegenerative disease unrelated to any mineral storage disorders. A 62-year-old male client is admitted to the hospital with acute pancreatitis. The client has a well-established history of alcohol abuse. The nurse caring for this client is aware he may exhibit withdrawal symptoms during the inpatient course. The nurse's plan of care for this client should include assessment for all the following symptoms of alcohol withdrawal except: A. Hypersomnolence. B. Tremors. C. Visual hallucinations. D. Hypertension. E. Seizure within the first 24 hours. The answer is A. Hypersomnolence. The symptoms of alcohol withdrawal may include confusion, disorientation, and anxiety. Hypersomnolence or excessive sleep is not associated with this condition. Additional symptoms may include agitation, hypervigilance, tremor, rapid and irregular heartbeat, hypertension, seizure, and hallucinations, mostly visual. Approximately 80% of strokes are of what type? A. Hemorrhagic. B. Transient ischemic attack. C. Ischemic. D. None of these. The answer is C. Ischemic. Approximately 80% of strokes are ischemic, either caused by thrombus or emboli. Hemorrhagic strokes only account for approximately 15% of all strokes, but are significantly more lethal and account for 30% of all stroke deaths. They involve the rupturing of a weakened blood vessel in the brain and subsequent bleeding in the surrounding areas. Transient ischemic attacks are not considered true strokes, and are often referred to as mini strokes. Which artery is most commonly involved in ischemic stroke? A. The middle cerebral artery. B. The anterior cerebral artery. C. The posterior cerebral artery. D. The posterior inferior cerebellar arteries. The answer is A. The middle cerebral artery. The most common artery occluded in ischemic stroke is the middle cerebral artery, which supplies a large percentage of the frontal lobe and the lateral surface of the temporal and parietal lobes. Occlusion of this artery affects the motor and sensory areas of the face, throat, arm, hand and the areas for speech.